Hello, everybody. Welcome to the Obesity Matters Wellness Workshop, where we embark on an incredible journey together towards better health and wellness. So, whether this is your first time or you have been with us since we started this program, we are grateful you are here. My name is Rachel. I'm the Vice Chair of Obesity Matters, and I am your host for this year-long program. Today's topic is healing emotional eating. Building a healthier relationship with food and yourself. Welcome, Sandy. Thank you for joining us for today's topic. We're very, very fortunate to have you here with us today and also have you as the medical advisor for Obesity Matters. So before we jump into today's conversation, do you want to share a little bit more about your background and the work that you do today, just to set the stage for what we're about to talk about?
Yeah, I wonder if some of you have already been in my past talks with Obesity Matters, so apologies in advance if my intro is a bit repetitive, but I'm Dr. Sandy Van. I'm a trained family doctor. I graduated from the University of Toronto in 2016. I did both my medical school and residency there, and I practice entirely in obesity medicine, along with using psychotherapeutic approaches in addition to obesity medicines, to help people with not only their weight, but their mental health and their overall well-being and functional fitness and spiritual health. It's a great privilege that I have to be able to speak to patients and how patients are really vulnerable with me and the things that they candidly share with me. And I feel like I have this really unique insight into eating behavior and the intersection of not only the emotional aspect of eating, but also the neuroscience and biology behind it, which I'm hoping to discuss with you today. I work at two clinics. One of them is MedCan and one of them is my own Haven Weight Management, a virtual clinic. Yeah, that's a little bit about me.
So the first thing I want to ask you is, what are some of those common triggers for emotional eating, and particularly, the emotions that lead to the overeating, and how can individuals build healthier coping mechanisms?
Emotional eating is such an interesting way to describe unplanned eating. I use emotional eating as a way to relate to patients. We use it really colloquially, but it actually doesn't have a definition in our psychiatric manuals of diagnoses. It is not suggested to be psychopathology in any way. To me, emotional eating is really just unplanned eating that has a reason attached to it. So a lot of my patients will describe that they are emotional eaters, and when you probe a little bit deeper as to what emotions are triggering it, it could be any emotion under the sun. It could be from positive emotions where it's celebratory, they're feeling good, they're happy. Really commonly, people are describing, or it could be somewhere in between where they're saying that it's not even an emotion at all, it's just boredom. Negative emotions, whether they're stressed, frustrated, feeling helpless. I'm not sure if you can call that an emotion, but I don't have one identifiable emotion that I can say is often causing overeating or unplanned eating. I think that we often can be more prone to overeating if we're experiencing an acute stressor, like if something immediately negatively is happening and we happen to be in a setting where we're most often eating, then yes, you could be susceptible. But let's say you're stressed and you're at work and you get some privacy in the washroom. You don't necessarily want to eat in that setting because you're not conditioned to want to eat in that setting. So I think that emotions play one small role in it, but that there's a whole other confluence of variables that can interact that cause somebody to eat in an unplanned way. Planned, or what else was like unintentional. Sometimes people consider it overeating. There's other ways to describe it. In the clinical world, we call it hedonic eating, which is eating for pleasure, or hedonic overeating, when you're eating for pleasure more than you plan to. And so, yeah, there's a lot of different ways to. And then on the other end of the spectrum, which I think we get to later, there's uncontrolled eating, where you really feel like you have zero control over those certain types of foods. And there's a whole spectrum when we characterize appetite.
With broad strokes, I guess, can you share how individuals typically build a healthier coping mechanisms?
Our brains evolved at a time where there was a lot of scarcity. So the brain that we have today is the same brain that evolved eons ago. And the only difference is the environment that we're in. I always mention this to my patients, that we as humans are hardwired and programmed to seek out calories effortlessly because it made sense at a time where scarcity and famine were a real threat. It's just that our brain doesn't really know the difference now, and it's almost like a child. Like you have to be the parent and redirect it, and that's the way I describe it. It's really effortless to seek out calories, and it makes sense that our brains would learn when you sought out calories, and especially if those calories were really pleasurable and reinforcing. That's how habits develop. Habits develop effortlessly in part, and it's mediated through this hormonal cascade in the brain where when you consume a tasty food, your brain reacts in the reward center. There's a part of the brain that's associated with cravings. The reward center releases opioids. You feel really good in that moment. And then because your brain knows that feeling good is good for you, it wants to learn more. So it releases dopamine that makes you capture the environment. It makes you learn it. It also makes you a lot more motivated to get more of whatever it was that gave you that little opioid rush. That's just a bit of scientific background to our affinity to food. And part of developing a healthy relationship with food is understanding that it is completely normal for you to want, even though you consciously know it's not appropriate.
So I wonder, how can we cultivate our self-compassion in order to reduce the frequency and intensity of these emotional eating, or should I say unplanned eating episodes?
I'm so proud to be part of Obesity Matters because it's such a positive spirited community. And I think that we highlight the condition of higher weight in a different way that has been unlike any other organization or group. And part of understanding obesity is understanding that obesity is a heritable trait. You guys have probably heard that time and time again from many speakers. The thing about the genetics associated with obesity are that these genes primarily affect appetite and where body weight's distributed and metabolism. But a lot of people think that they're on an even playing field when it comes to calorie intake. But that's not actually true. Some people who are born to obesity have very strong reward drive, meaning that you're more prone to cravings, or you're more prone to liking, and you're more prone to learning certain food behaviors in a way that becomes more effortless versus somebody who might be born to two lean parents, where if they eat something, they might eat some chips and then their appetite system shuts down because they've had enough and they're satisfied, right? We actually see in MRI studies of people's brains who live with obesity that reward drive can be a bit more sensitive and food is more salient. And so part of this self-compassionate approach is understanding that your weight is not your fault. That excess weight is something that is really complex, and it's a byproduct of not only genetics. We have up to 1,000 genes that have been identified to manipulate weight status, body shape, appetite. It's not only genes, but also the environment that we grow up in. So as I said, we're hardwired to seek out foods effortlessly. And in an environment where that makes it easier to get and cheaper to get ultra processed foods than it is to get whole foods, it makes sense that your brain would naturally learn that more easily. There's no one unidirectional approach to obesity. There's so many different ways, which is why I do psychotherapy as well. Like mental health plays a role, environment plays a role, socioeconomic status plays a role. It's not your fault that you have obesity if you have obesity. And so it starts there. The reason why I say that is because this lack of self-compassion and the shame that we see in that polling is typically a byproduct of something called internalized weight bias. And there has been a lot of research done about the role of internalized weight bias and weight stigma on the way that somebody eats later in life, or the relationship they develop with food, or their weight later in life. It tends to be associated with higher BMIs. So internalized weight bias is when you actually blame yourself for your weight, when you feel badly about your weight, when you think you're a failure, when you think you did this to yourself, and you believe all that societal messaging about weight, right? So the reason I'm saying that is because it's hard to develop self-compassion when you actually believe that to be true.
Final question, and then we'll start to see if there are folks in the audience that would like to ask questions. How can CBT, or cognitive behavioral therapy, be used to address patterns of emotional eating and promote healthier thought patterns?
CBT it's my first baby. This is the thing I got into. You have a really active chat, by the way. Good for you guys. You guys are a good audience there. Because I've been reading some of the things that are coming in, and somebody earlier on said, I'm always interested in why someone focused on obesity in their career choice. And my initial focus was actually psychotherapy and CBT, because mental health was actually really prevalent in family practice as well. So, but I also knew that there was this intersection with mental health and obesity that was really interesting, that a lot of the time people who had mood disorders would also have obesity, and vice versa. People who had obesity or newly gained weight would also be more prone to mood disorders like depression and anxiety. And so that's why I started learning about cognitive behavioral therapy. Kind of a mouthful of a word to say, so I'll just call it CBT. But cognitive means thoughts, and behavioral and therapy, you already know what those words are. But the idea of CBT is it's based on the premise that your emotions and your behavior are directly tied to your thought processes. And if I asked you to sit there for a minute and not think about anything, it would actually be impossible, because your mind is just constantly generating thoughts. You'd probably be thinking to yourself, I wonder why she's making me go through this, or what am I going to be eating for lunch, or what do I have to take out to defrost for dinner? Like, you would just be coming up with like a million thoughts a minute. And so it's not natural to think about our thinking, but it's actually really an important skill set to have, in part because the emotions and the behavior that you engage in on a day-to-day are inevitably going to be an outgrowth of the automatic thoughts you have.
I have a question about CBT and negative thoughts. Like, I would like to change my thought processes into more positive thoughts. So I was wondering if there's any books or resources you recommend for that.
Oh, yes. This first book is my bestie, Sandra Elia. She really does a good job at teaching you to change the way you think about yourself and to develop a more self-compassionate approach with your well-being. So that's never enough. Okay, this book is a bit diety. I always a little hesitant to recommend this book, but I'll be honest, that the author of this book was the daughter of the founder of cognitive behavioral therapy. Oh. But she writes a book called The Diet Trap that highlights all of those thinking traps that we consider automatic negative thoughts. Right. And just ways, strategies to respond to them in those moments. And her technique is coping cards, using like cue cards to respond in those moments and having those available. I actually like this one. A lot of my patients like it too, but it's a bit gimmicky. It's a bit diety, like weigh yourself every day, which you don't have to do. But so you got to cherry pick. The Diet Trap is also a good one for those who don't like fighting back their thoughts and want to just create space for their negative thoughts and create space for some of those negative emotions without having to always rebuttal. This is a good one because it's based on an approach that is an extension of CBT called acceptance-based commitment therapy. And so it's really helpful to tune that awareness, that self-awareness, to observe negative thinking, but you're not necessarily doing anything with it. You're actually just learning to commit to actions that are important with the negative thoughts running in the background. That one's also a very good technique. And then for those who I had some questions about mental health and depression and anxiety in the chat. For those who want to learn about CBT for mental health, I swear by this book, Feeling Good. It is thick, like super duper thick. That text is looking small too, right? Like I would probably get this on an audio book or while you're doing errands. But this one's a good one. I've actually had patients with severe body image dissatisfaction, despite not having significantly high weights, who I've prescribed this book, and they come back to me months later, like they don't even book a monthly follow-up. And they're like, thanks for prescribing that book. I actually feel totally better now. Like they actually go through the exercises. They tackle those negative thoughts they have. They understand the way their mind works a bit better, and they can find ways to respond adaptively to negative thinking. So this one's a really good one if you've got the time and you've got features of anxiety or depression to work with, but also translatable to weight management.
Thank you for joining us today. Remember that our journey towards better health is not a solitary one. We are all here to support and uplift one another. See you next time.